Hey everyone, and welcome back to Health Science 1. Today we are going to be learning about the disorders of the digestive system. Hopefully yesterday you enjoyed the digestive system lab where you got to watch me make fake edible poop and you learned more about the entire process of the digestive system, and hopefully it gave you a visual of what that process actually looks like if you're able to compare it to real life scenarios. So today we're going to talk about the disorders, and there are several different ones that sound very similar but are not the same, so hopefully you will not get confused. Let's go ahead and begin. The first disorder we're going to talk about today is cholecystitis. Cholecystitis is the inflammation of the actual gallbladder. We know that the word chole means bile, and cyst means a sac containing some type of fluid, and itis means inflammation. That sac containing bile is the gallbladder. So that gallbladder is that accessory organ that stores our bile and saves it for when we need to break down fatty foods. And so cholecystitis is just the inflammation of the actual gallbladder. Typically, with chronic cholecystitis, we do eventually have to remove the gallbladder, which we're going to talk about here in a second. You can live without your gallbladder. You do not need it to be able to function. You just have to pay more attention to your diet because you now do not have that extra storage of bile in your system. Cholelithiasis, I struggle every time with this word. Cholelithiasis is gallstones. So the word chole again means bile, and lith actually means stone. The root word of lith means stone. So cholelithiasis is just gallstones, which can be kind of painful. Gallstones can lead to that inflammation of the gallbladder and overall just lead to an improper function of the gallbladder. A cholecystectomy is the surgical removal of the gallbladder. So again, cholecyst, if you see cholecyst next to each other, that typically means gallbladder. And ectomy, means surgical removal of. So a cholecystectomy is the removal of that gallbladder, which again is a really common surgery that does happen, and you can live without your gallbladder. And then constipation is just a word that means the infrequent bowel movements, which typically lead with hard, dry feces. And these, the symptom of constipation can be a side effect of different medications. It can be a side effect of having issues with your gallbladder. There's a lot of different things that can cause constipation. If you're dehydrated, that can lead to it. And the one way to really treat constipation is to eat a diet high in fiber, to take in more fluids, and to exercise. I'm going to move my little camera over because I'm always in the way. Next, we have cirrhosis. Cirrhosis is the chronic progressive disease of the liver. And typically cirrhosis can be caused by alcohol consumption, but there are also types of cirrhosis that are not caused by alcohol consumption, and those are typically referred to as non-alcoholic fatty liver disease. Cirrhosis basically is when the normal tissue of the liver is replaced by fibrous connective tissue, and so the liver starts to become harder and more difficult to function, and eventually stops functioning altogether. Like I said, 75% of cases of cirrhosis are caused by excessive alcohol consumption. Cirrhosis is a really common disease in alcoholics, and Tylenol abuse, the ingredient that goes into Tylenol, can also lead to cirrhosis of the liver, which is why it's important to not take only Tylenol and take it excessively or in really high amounts for long periods of time. That's why there are other medications out there that do serve as pain relievers that are not actually the ingredient of acetaminophen. Acetaminophen is the ingredient in Tylenol, which can lead to cirrhosis. There are also things like diet and exercise that affect cirrhosis. And if you are not eating right, or you're eating really high fat meals all the time and you're not exercising, you can get fatty liver disease, which is also cirrhosis. Gastroenteritis/diarrhea, we're going to talk about them because they're kind of one and the same. Gastroenteritis, we can break it apart into gastroenteritis. Gastro means stomach, enter means intestine, and itis means inflammation. So this is an inflammation of that mucosal membrane that kind of surrounds the stomach and the intestines. It's typically caused by a virus, And symptoms of gastroenteritis include things like vomiting and diarrhea that last anywhere between 24 to 36 hours. The most common complication related to gastroenteritis is just dehydration, because you're losing so much fluid through either vomiting or diarrhea that you're not able to get those back into your system and you become dehydrated. Diarrhea is just a fancy word for the frequent loose stool that sometimes comes as a side effect of different medications or illnesses. The next disorder we're going to be talking about is gastroesophageal reflux disease, which is commonly referred to as GERD. This occurs when acid in the stomach regurgitates up into the esophagus. So if you remember when we talked about the structures of the digestive system, we talked about how you have a sphincter muscle at the top of your stomach and one at the bottom of your stomach. Well, that sphincter muscle at the top of your stomach is there to help control the amount of stomach acid that comes out of the stomach. So that sphincter opens to let food into the stomach, and then it closes again so that stomach acid isn't splashing up into your esophagus. There are times where it maybe doesn't close fast enough, or certain types of food irritate it, and some of that stomach acid gets up into the esophagus. And this is how you get that sour, bitter taste in your mouth, or you might feel like you have heartburn. That is all related to GERD. Just because you have a one-time occurrence of heartburn or a one-time occurrence of feeling that bitter taste in your mouth does not mean you necessarily have GERD. It just means you have a case of heartburn. But the constant, this happening very frequently may mean that there's something wrong with that sphincter muscle and it's not working properly. And so that can lead to this gastroesophageal reflux disease. This can also cause difficulty swallowing, and typically the way that GERD is treated is by avoiding foods that irritate it or cause it to be inflamed. And so that is things like avoiding chocolate, peppermint, coffee, citrus, fatty or fried foods, and then stopping any smoking if that person is smoking. Taking antacids. Antacids is a type of medication you can take that calms the acidity so that you don't feel the symptoms as much. And then, of course, not lying down within 2 to 3 hours of eating. If you go and you eat and then you immediately lay down, that is typically what's going to lead to that acid leaking up into the esophagus and causing that heartburn feeling, or that gastric acid reflux. So by not lying down and letting your food actually digest a little more and process, you can prevent some of those symptoms. A hiatal hernia is a condition in which the upper part of your stomach bulges through an opening in your diaphragm. This is more common typically in people after the age of 50, and you are at a higher risk if you are obese or smoke. Some of the treatment options for hiatal hernias include things like eating really small meals and avoiding certain trigger foods, and of course not smoking and not drinking alcohol. You can also lose weight because obesity is a risk factor. So by losing weight, you can lower your risk of a hiatal hernia, or you can also help treat any that you may already have. And really the only treatment for hiatal hernias is that you might be prescribed certain antacids by your doctor or any other medications to decrease the size of the hernia and decrease the symptoms. Hepatitis, we know that hepat means liver and itis means inflammation. So hepatitis is the inflammation of the liver. There are three different types of hepatitis: hepatitis A, B, and C. Hepatitis A is typically spread through contaminated food or water. And then hepatitis B and C are actually caused by a virus, and they are spread through blood and body fluids and things like that. So later in Health Science 2, you'll learn a lot about universal precautions and PPE. And so it's important to know that with those types of hepatitis, you have to use proper protective equipment to protect yourself. Versus whereas hepatitis A, there's really nothing you can do to prevent that from happening except, be very cautious and aware of what you're eating and drinking. Irritable bowel syndrome is often referred to as IBS, and this is a disorder that affects the large intestine. IBS includes a lot of different symptoms, and they kind of vary from patient to patient, but they typically include things like cramping and abdominal pain, lots of bloating, gas, diarrhea, constipation, or a combination of many of these symptoms. And it's a chronic condition, meaning that it requires long-term management. And as of right now, there's not really a cure-all for IBS. Now, later today in your journal entry, you're actually going to be watching a video about some research that not a local doctor, but a doctor has been doing on IBS and what up until this point, basically, most people think IBS is just a side effect of diet and nutrition and stress. But there's a doctor who is actually discovering something that might be a little different about IBS and maybe the cause. And they're coming up with new ways to treat IBS. So you're going to learn about this condition more in your journal. An interesting thing to note is that IBS is more common in women, and we really don't know why that is. And then the last disorder that we're going to be talking about, let me move my camera so that you can actually see the image on the screen, is peptic ulcers. Peptic ulcers are sores or lesions that happen within that the mucosal lining inside the stomach. And these are also referred to as gastric ulcers. Duodenal ulcers are basically the same thing, but they happen in the actual duodenum of the stomach. And the primary cause of all of these ulcers is the H. pylori bacteria. Some things that might contribute to forming a peptic ulcer are smoking, alcohol, stress, and certain drugs. Most commonly, they are caused by certain medications that someone might take, but high levels of stress can also cause ulcers. Think about if you've ever gotten an ulcer in your mouth. Those are also sometimes caused by stress, and so think about the amount of stress you get, and sometimes you end up with an ulcer in your mouth. If you just elevated that stress even more and combined it with other factors, you could end up with that kind of ulcer, but inside of your stomach. Some symptoms of ulcers are burning pain in the abdomen between meals and early morning. And the reason for this is because that is when your digestive system is active. And so if you've just eaten and your digestive system is active and that acid is splashing all around in your stomach and you have an ulcer, it doesn't feel good for the acid to be getting on your ulcer. And really the only way to relieve these symptoms is to eat, which seems counterintuitive because then you're going to have to digest that food. But the process of eating actually calms the stomach down a little bit. And so then for a little while you get relief or taking antacids. The diagnosis of a peptic ulcer is basically an x-ray and a blood test. And then the treatment is a medication called an H2 blocker, which is just the drug that blocks the release of histamine and releases some of that irritation. That is everything for disorders of the digestive system. So you do have an assignment, some assignments you're going to continue working on today, and a new assignment that you're going to start that are not due until the weekend. And then your daily journal, like I said, is going to be a lot about IBS and a doctor that has found some new research related to IBS, and then your daily journal. If you have any questions, feel free to reach out to me as always, and I hope you all have a great day. Bye, guys.